Recently, you have been scheduled to undergo thumb CMC arthroplasty, and I made this video to explain to you what to expect for the surgery. As we talk preoperatively, the surgery will be done using a regional block where an anesthesiologist will inject anesthesia to your arm, your extremity will go to sleep. The key for this procedure is to remove a bone that has become arthritic, which is called the trapezium. The trapezium has to be excised, which is called the trapeziectomy. Then we have a void space in the area that we need to create some type of structural support to prevent the thumb metacarpal to collapse down. In order to do that, I use a system called the FiberLock system produced by a company called Arthrex, which entails for me to create a structure that will secure a fiber tape, which is a very thick and strong permanent suture that gets embedded to the second metacarpal all the way down to the thumb. I usually put a guide wire which will pass through the second metacarpal, then the suture will be placed, and then I secure that to the base of your thumb metacarpal, placing that suture inside of the bone with a plastic screw. That void space is then filled with the material to create a scar tissue to prevent collapse of the bone. After the surgery, you will have a splint that will keep your hand and thumb protected on a thumb spica splint. You will keep the splint in place for 2 weeks. Do not remove it, don't get it wet. If you need to take a shower, just put a plastic bag. When you return to my office, you will see 2 people. You will see me, also you're going to see my hand therapist. When I see you, I will remove that entire dressing, we'll look at your incision, make sure it's looking good, then I will obtain x-rays to see how much suspension I still have it over there. You will be referred to my physical therapist, and then we'll create a custom-made splint for your hand, and your therapy will be started at that time. There's a lot of therapy coming up. You will see that you're going to be seeing my therapist. Normally, I will see you back when you're 6 weeks out, and the longer splint is going to be shrunk to a hand-based splint. And you're still going to continue to wear the splint, then we'll transition off the splint about 10 weeks or so. My therapist will give you all the guidance for you. I will normally see you at week number 2, 6 weeks, 12 weeks, 3 months, and 1 year. Remember that I told you this is a year process. You got to be patient. The beginning it's hard, but then it gets better more and more. Thanks for choosing me as your surgeon. And I'm very excited that I'll be able to participate in this journey with you.